to our students in the NSTP-CWTS. I am Professor J. Lord Assis, and I will be discussing to you today on substance abuse education. This is just a reminder to all of you that drugs are the enemies of ambition and hope, and when we fight against drugs, we are fighting for our future. So I am the faculty of the College of Management, and I am also the advisor of the Supreme Student Council of Capiz State University main campus. I will be discussing to you now the national situation from the PIDEA 2017 annual report. The Philippines remains to be a country that produces and consumes illegal drugs. Illegal drugs proliferate in the Philippine market because of the huge number of drug dependents who patronize not only one but several types of illegal drugs, or otherwise called the polydrug users. So two of the most prevalent, most abused drugs in the Philippines are methamphetamine hydrochloride, or we call it the shabu, the cannabis sativa, or marijuana. Based on the data of drug-related arrests in the country, the main drug of choice is shabu, which has a 96.43%, marijuana with 3.36%, and other drugs like ecstasy, cocaine, Nubain, Valium with 0.21%. Now, let's go to the definition and other related terms. Drugs are chemical substance that affects a person in such a way as to bring about psychological, emotional, or behavioral change. Dangerous drugs are those that have high tendency for abuse and dependency. These substances may be organic or synthetic and pose harm to those who use them. When we talked about drug abuse, it is the continuous misuse of any substance, licit, illicit, which results to changes in an individual's physical, mental, or behavioral condition. Drug abuse exists when a person continually uses a drug other than its intended purpose. This continued use can lead to drug dependence, a state of physical and psychological dependence, or both, on a dangerous drugs. Drug dependency. This is the state of physical and psychological dependence, or both, on a dangerous drug or drugs experienced by a person following the use of that substance on a periodic or continuous basis. A person dependent on drugs will experience withdrawal reactions, also known as cold turkey, symptoms that occur after long-term use of drug is reduced or stopped abruptly after abstaining from drugs. Drug addiction is a complex and often chronic brain disease. It is characterized by excessive drug craving, seeking, and use. Addiction is caused by brain changes caused by constant drug use. Now, what are the reasons for abusing drugs? First is experimenting. It is not uncommon for addiction to stem from a person being curious and experimenting with drugs or alcohol. It is a scenario that often starts a young person using alcohol or marijuana out of curiosity. While it seems harmless, adolescents that, according to the National Institute on Drug Abuse. Second, we have what we call the family history or genetics. If you have a family history of drug addiction, you may have a genetic predisposition to develop an addiction to drugs or alcohol. It is stated that about 30% or 70% of a person's risk for addiction is linked to the genes they are born with, along with other social factors. Another is what we call the prescription drugs. There is a popular misconception that any medication prescribed by a doctor is safe. Unfortunately, that is not always the case. Doctors prescribe medications to alleviate symptoms of physical or mental health issues. However, many individuals are not properly educated on that the medication may carry. Sometimes chronic pain is often managed through opioid medications, which are highly addictive. Next is prescription drugs. There are people who are dependent upon the amount used and other factors. Someone may require a medical detox just to stop using the opioids. Likewise, those suffering from anxiety and depression may be prescribed addictive medications to ease symptoms. Non-addictive medications and or pain recovery services are often available. Other factor is loneliness. Addiction can start when an individual feels lonely or is isolated from the friends and family. They turn to drugs and alcohol thinking that it will fill a void that they have been living with. People lacking positive daily interaction may choose to use substance to feel happy or content. Additionally, users begin to alienate themselves further if they fear being judged or that help is not available to them. Other factor is what we call the peer pressure. Peer pressure usually applies to adolescents or young adults. It is what we call the need to fit in on some level. It is to build into each one and every one of us. Some people may feel the need to participate in potentially harmful activities to do so. The pressure of being around others who are abusing drugs or alcohol can push someone to follow suit. Other factor is drugs and alcohol can make you feel good. There is a popular quote in the Big Book of Alcoholics Anonymous that states, "Men and women drink essentially because they like the effect produced by alcohol." While this seems obvious, some people like the effect so much that they are unable to stop. It may be difficult to see the harm in something that makes you feel good. Other factor is what we call the mental health disorder. Depression, anxiety, and PTSD can put individuals at higher risk of developing an addiction. Using substances to cope with difficult feelings may seem like an easier path for some. Though they may seem crippling at times, there is a help available to anyone struggling with a mental disorder. So non-narcotic medications are often available for most mental health disorders. So it's worth researching with a doctor to see if there is an alternative to addictive medications. Other factor why people engage into drugs, somehow it is for just recreation. Many people use drugs or alcohol socially with friends or to unwind after a long day of tiresome work. Risks experiment with drugs and alcohol are more likely to develop substance use disorder. They often see substances as a way to relax or clear their minds. So recreational drug users are still at risk to become addicted if their use becomes more frequent or they use highly addictive substances. Sometimes other reason is alcohol isn't enough. For some, alcohol stops doing the trick. A few beers after work or having drinks with friends at a local bar just doesn't have the same effect that it used to. Some individuals end up chasing a buzz that they were once able to attain with a few drinks. This can leave someone powerless over alcohol and unable to quit drinking. Other reason why we are addicted into drugs or engaged into drug is what we call the self-medicating. People struggling with any of a multitude of ailments may turn to drugs or alcohol to ease their pain. Mental health disorders and chronic pain leave some seeking solutions on their own. Alcohol or other substances can alleviate symptoms and seem like a short-term solution. However, people should look for manageable, long-term solutions under medical supervision to combat these issues. What are the common signs of drug abuse? So here are the profile of a drug dependent or a substance abuser. It's as follows. First, changes in attendance in schoolwork if you're always absent. Changes in the normal capabilities in schoolwork. Abrupt changes in overall attitude. Generally lazy, irritable, discourteous, aggressive. Usually untrustworthy and lacks self-confidence. Manipulative. Have a distorted view of reality. Low frustration tolerance. Con game player. Lacks interest in his studies, work. This is what we call withdrawal from responsibilities. Blames everybody but himself. We call that person as a blame tosser. You will have no respect for the rights of others. You wanted to stay or you prefer to stay with peers or with your barkada. May frequently go to odd places just to take the drugs. You will have now a poor physical appearance. You are no longer concerned with your grooming and hygiene. You always wearing sunglasses at inappropriate times. Even though it's night, you are wearing sunglasses. Unusual effort to cover arms to hide needle marks. You always wear long sleeves garments. You are engaging into stealing items which can be readily sold. Unusual borrowing of money from relatives and friends. Association with known drug abusers. So commonly abused drugs and their effects. What are the commonly abused drugs? First is alcohol. So alcohol abuse is a pattern of problem drinking that results in health consequences, social problems, or both. However, Alcohol dependence or alcoholism refers to a disease that is characterized by abnormal alcohol-seeking behavior that leads to impaired controlled overdrinking. So what is the effect? What are the effects of alcohol? Short-term effects of alcohol use include distorted vision, hearing, and coordination, impaired judgment, altered perceptions and emotions, bad breath, hangover. This is what we call also a long-term effects of heavy alcohol. First is loss of appetite, vitamin deficiencies, stomach ailments, skin problems, sexual impotence, liver damage, heart and central nervous system damage, memory loss, etc. That's the effect, the short-term effect and the long-term effect of alcohol. Now let's go to methamphetamine, or commonly known as shabu. So methamphetamine is a stimulant drug chemically related to amphetamine, but with stronger effects on the central nervous system. Street names for the drug include speed, meth, and crank. Methamphetamine is used in pill form or in powdered form by snorting or injecting. Crystallized methamphetamine, known as ice, crystal, or glass, is smokable and a more powerful form of the drug. So effects of methamphetamine use include hypothermia, convulsions, and cardiovascular problems which can lead to death. Irritability, confusion, tremors, anxiety, paranoia, or violent behavior can cause irreversible damage to blood vessels in the brain, producing strokes. That's the effect. Methamphetamine users who inject the drug and share needles are at risk of acquiring HIV or AIDS. The next kind of drugs is the cocaine. Cocaine is a white powder that comes from the leaves of the South American coca plants. Cocaine is either snorted through the nasal passages or injected intravenously. Cocaine belongs to a class of drugs known as stimulants, which tend to give a temporary illusion of limitless power and energy that leave the user feeling depressed, edgy, and craving for more. So crack is smokable form of cocaine that has been chemically altered. Cocaine and crack are highly addictive. This addiction can erode physical and mental health and can become so strong that these drugs dominate all aspects on an addict's life. So physical risks associated with using any amount of cocaine and crack: increase in blood pressure, heart rate, breathing rate, and body temperature, heart attacks, strokes, and respiratory failures, hepatitis or AIDS through shared needles, brain seizures, reductions of the body's ability to resist and combat infections. That's the effect. The psychological effects: you will become violent, erratic, paranoid behavior, hallucinations and coke bags, a sensations of imaginary insects crawling over the skin. You feel that you have so many insects there. That's why we call this the coke bags. Confusion, anxiety and depression, loss of interest or in food or sex. Cocaine, we have this also what we call the cocaine psychosis, the losing of touch with reality, the loss of interest in friends, family, sports, hobbies, and other activities. So some users spend hundreds of thousands of money on cocaine and crack each week and will do anything to support their habit. So many turn drug selling. You are an addict, you are a user, If you do not have money, then you turn into drug selling, prostitutions, or other crimes. Cocaine and cracks addicts often become unable to function sexually. Even first-time users may experience seizures or heart attacks, which can be fatal. Next kind of drug is what we call the hallucinogens. Hallucinogenic drugs are substances that distort the perception of objective reality. So the most well-known hallucinogens include the phencyclidine, otherwise known as the PCP, angel dust or love boat, lysergic acid, diethylamide, commonly known as the LSD or acid, mescaline, and peyote, and psilocybin, or the magic mushrooms. So under the influence of hallucinogens, the senses of direction, distance, and time become distorted. These drugs can produce unpredictable, erratic, and violent behavior in use that sometimes lead to serious injuries and death. The effect of hallucinogens can last for 12 hours. LSD produces tolerance so that users who take the drug repeatedly must take higher and higher doses in order to achieve the same state of intoxication. This is extremely dangerous, given the unpredictability of the drug, and can result in increased risk of convulsions, coma, heart and lung failures, and even death. So, what are the physical risks associated with using hallucinogens? Increased heart rate and blood pressure, sleepless and tremors, lack of muscular coordination, sparse, mangled and incoherent speech, decreased awareness of touch and pain that can result in self-inflicted injuries, convulsions, coma, heart and lung failures. The psychological risk associated with the using of hallucinogens are first, a sense of distance and estrangement, depression, anxiety, paranoia, violent behavior, confusion, suspicion, and loss of control, flashbacks, behavioral similar to schizophrenic psychosis, buang-buang, catatonic syndrome, whereby the users becomes mute, lethargic, disoriented, and makes meaningless, repetitive movements. So everyone reacts differently to hallucinogens. There is no way to predict if someone can avoid a what we call bad trip. Next is the marijuana or the cannabis sativa. So marijuana is the most widely used illicit drugs in the United States and tends to be the first illegal drug teens use. It can be either smoked or swallowed. The short-term effects of using marijuana is sleepiness, patulog ka, difficulty keeping track of time, impaired or reduced short-term memory, reduced ability to perform tasks requiring concentration and coordination, increased heart rate, potential cardiac dangers for those with pre-existing heart disease, bloodshot eyes, mapula imong mata, dry mouth and throat, decreased social inhibitions, and paranoia, and of course, hallucinations. But this is what we call long-term effects of using marijuana. You will have an enhanced cancer risk, decrease in testosterone levels for men, also lower sperm counts and difficulty having children, increase in testosterone levels for women, also increased risk of infertility, diminished or extinguished sexual pleasure, psychological dependence, acquiring more of the drug to get the same effect. So the physical effects of marijuana use, particularly on developing adolescents, can be acute. Marijuana blocks the messages going to your brain and alters your perceptions and emotions, visions, hearing, and coordinations. A recent study of 1,023 trauma patients admitted to a shock trauma unit found that one-third had a marijuana in their blood. So what are the effects of drug abuse? In several sources, it has been indicated that there are many effects of drug abuse. In physiological and physical effects, systemic, we have the cardiac pathology, irregularity of heartbeat, elevated of lowered blood pressure, chest pain, convulsions, or death from the cardiac arrest, pulmonary illnesses, hepatic problems, or what we call sa liver, renal kidney diseases. In a general health, you will have malnutrition or weight loss, infections, accidents, blood transmitted diseases. In usage, you will have tolerance. The individual needs more drugs to achieve the same effects they did previously with a smaller amount. Next is dependence. The substance becomes the central point to the individual's life, and they can't function properly without it. Withdrawal. This happens when the individual reduced or stopped the substance use. And last is the overdose. The level of intoxication reaches a point where it begins to produce physical and psychological harm, which may lead to death. In mental health effect, you will have perception. In perception, we called it auditory and visual hallucinations. In terms of orientation, we call it the paranoia. You will become psychotic. There's also problem in memory, loss of memory. You will have also a problem of judgment, in which it is associated with depression that lead to suicide, associated with stress, either heightening or weakening emotions. It has also what we call an economic effects. First is employment loss. Individual loss their effectivity and efficiency in the workplace. You will have also what we call the academic difficulties for the youth like you. Being unable to accomplish the coursework can affect the performance at school and their grades. You will also experience financial problems. So addiction to substance requires more monetary resources since the individual is forced to consume more of the substance to get their fix. You will have also, in terms of social effects, you will have also conflictual, dysfunctional relationships. When we talk about conflictual, dysfunctional relationships, an individual under the influence of drugs creates tension and conflicts with their family members and among their peers that can result in broken relationship and abandonment. You will become violent, or we call it the violence. So some of the chemicals in the abused substance can impair the mind to think illogically and to act aggressively that can have the individual act violently in social settings. Safety. No? So an individual under the influence of drugs can put someone in dangerous circumstances and can be prone to accidents. So what are the classification of drug abusers? Substance can be classified according to the frequency of their substance use. We have what we call the experimenters. When we talk about experimenters, there are people who abuse the drugs for experimental basis. We have what we call the occasional users. Abuse the drug occasionally whenever there are special occasions. They abuse the drug once every 2 weeks or 2 times a week. We have also the regular users. Abuse the drug on a regular basis, approximately 3 to 4 times a week or every other day. We have also what we call the drug dependents. People who tend to abuse the drugs every day, almost every day, or about 5 to 7 times a week. And we have also what we call the mentally ill chemical abusers, substance-induced psychosis. These are they abuse the drugs occasionally whenever there are special occasions. Okay? So, substance dependency and keeping drug free. What are the criteria for drug dependency? Withdrawal symptoms, need to take drugs to overcome withdrawal symptoms, compulsion, tolerance, relapse, reduce social, occupational act. Okay? So these are the criteria for drug dependency. Substance dependency and keeping drug free. Classifications. How can you stay away from drugs? Devote yourself to your studies and other productive activities at home or in school. Stay away from people, places, and events that promote drug use. Learn to manage feelings and cope with stress without using drugs. You have to develop a strong moral and spiritual formation. Educate yourself about the effects of drug abuse and always say no. So, what are the countermeasures for substance abuse? Abstainer, you can have your preventive education. Experimenters, occasional users, regular users, you can have a counseling. Drug dependence, go to a drug rehabilitations. Mentally ill, chemical abusers, you have to go to a psychiatric treatment. That's how we counter attack ang mga classes ng mga drug dependence. For the Comprehensive Dangerous Drug Act of 2002, Comprehensive Dangerous Drug Act of 2002 or Republic Act 9165 is an act that supersedes RA 6425 or the Dangerous Drug Acts of 1972. This amended law practices a more intensive approach against drug abuse, trafficking, and enforcement. It also gives emphasis on the role of the educational system in information, dissemination, and prevention campaign. It re-evaluates the procedures, policies, and programs concerning drug abuse. It highlights the importance of rehabilitations and reintegrations of rehabilitated individuals to society. Unlawful acts and penalties, Section 5, sale, trading, administration, dispensation, delivery, distributions, and transportations of dangerous drugs and or controlled precursors and essential chemicals. Maintenance of a den, dive or resort, possessions of dangerous drugs, use of dangerous drugs, and lawful prescriptions of dangerous drugs. So, dangerous drug test and records requirement, Section 36, you will have now authorized drug testing. So, participation of the family, student, teachers, and school authorities in the enforcement of the act. Here in Capiz State University, I think we will start already the drug testing for our first year students, and supposed to be it started this semester, this school year, but because of the pandemic, it will be scheduled again. We have what we call in Section 46 of this law, you will have the Special Drug Education Center. There are also programs for treatment and rehabilitations of drug dependence. Voluntary submission of a drug dependent to confinement, treatment, and rehabilitation. Confidentiality of records under the voluntary submission program. Compulsory confinement of a drug dependent who refuses to apply under the voluntary submission program. Youth in drug abuse prevention. As a drug abuse and addiction is prevalent in younger generation, it is imperative that the youth take part in its prevention and rehabilitation effort. Youth group or organizations can be a vehicle in which their community can help alleviate or eradicate the possibility of drug abuse. Whether individual or as a group, the youth is a good driving force that could shape the drug abuse prevention initiative of this country. So here are some ways the youth can step up in this endeavor. First, you have to understand. You have to understand you have to understand the concept and reality of drug abuse. Having a grasp of the addiction can help in avoiding it and watching out for others. Listen. Open yourself up in the knowledge of the experts and the experiences of others that have undergone the abuse. Hear the stories and get lessons to the heart. You have also to share. Share your knowledge and network in aiding others towards being informed and recognizing their role in drug prevention. You can also encourage the youth. Give your peers and family members give your peers and family members encourage. Give your peers and family members a good push in the right direction, whether it's prevention or rehabilitation. Support. Take part in activities beneficial in the drug abuse prevention initiative. Add your presence to the growing force tackling this issue. Next is organize. Great minds think alike. Having a mutual goal. It is more purposeful to combine efforts and sources to create a bigger impact about the concern. Inform. Approach appropriate government agencies regarding incidents and cases of drug abuse. Okay? So, thank you very much. I hope that all our students of Capiz State University, especially in first year taking up CWTS, NSTP, CWTS, all of you are not using drugs. So again, I am Professor J. Lord Asis. Keep safe and thank you very much.